My name is my name is Mary Koshi, and I'm the Associate Director in the Office for Diversity and Inclusion. We are celebrating Disability Awareness Month this October, and we have with us today Silvina De La Iglesia from the Language Assistance Program. She's an Associate Director there at Mount Sinai Health System. She will be talking to us today about Better Together, leveraging our values to serve our most vulnerable patients during the pandemic. So thank you for all of those who joined with us this morning. We have two more talks, part of our series for this month, two more talks next week. So we encourage you to register if you have not done so already. So with that, we're really grateful for Silvina taking time from her busy schedule on the front lines for joining us today. So Silvina, I'll pass it on to you. Thank you.
Sure. Good morning, everyone, and welcome to our first virtual Lunch and Learn session. We're going virtual this year. It is really my pleasure to share with all of you some of the work that we have been doing during the pandemic, some of the work that we have done for our most vulnerable patients. And I am talking today on behalf of my colleagues from the language assistance programs, coordinators, interpreters for spoken languages, sign language interpreters, but also our Department of Patient Relations, as we work very, very closely with our patient representatives and our patient experience team. So it's just it's just a summary of some of the things that we have done, and absolutely we welcome all kind of suggestions for improvement, any feedback. So I'll be happy to take all questions at the end of the presentation. Mary, can we go to the next slide, please? Thank you. Some of you may remember that we, early last year and this year, we all were called to attend a training session, not really a training, it was rather an interactive session called The Experience, right? And you may remember this poster. This poster represents who we are as a health system, and those sessions were an invitation to really reflect who we are as a health system, who do we want to become, and really aligned our values with our safe risk behaviors to really reflect how those values impact our daily actions on a day-to-day basis. And at that time, I was one of the co-facilitators. We saw many different reactions from people. Some of them were very happy to be there, very engaging, and they were participating a lot. And some others were like, what am I doing here? Am I really supposed to be here for 4 hours? And it seems some of the concepts seems like a very abstract thing to apply, right? When we talk about values, we talk about vision, we have a talk about institutional mission and our cultural transformation. So this poster represented really the complexity of our health system, the complexity of the patient population that we serve, and some of the efforts that we need to put into place in order to deliver good health and accessible health care for our patients. Next slide, please. So some of these values, and I'm just gonna show them to you, and you may be familiar with them already. The values that were chosen for our healthcare are safety, agility, creativity, empathy, and teamwork. We were asking everybody to show examples of how you, display these values on your daily actions. Some of them were very, very shy, to present examples. But then I think COVID-19, we did this training probably from mid 2019 to February Was it February? Yeah, February this year. I was actually the one that closed the last session of the experience right before COVID was coming into place. And at that time, I can say we trained about 13,000 employees. And the timing for these sessions couldn't have been, more perfect because a week later, COVID came in and it hit us really hard. But I think at some point we were really prepared to display these values and see how we could translate these values into actions. So next slide, please. So from the language perspective, from the patient representative perspective, how did our values shape the way that we deliver services? For us, this means interpreting at the front lines, whether it was in person, virtually, or over the phone, translating patient-facing material, and also making sure that that material was accessible to patients and to their families. Let's not forget the families, right? When we talk about patients, we also need to make sure that the family is included all the way. Proactive rounding, right? We couldn't just sit and wait for things to come to us. We have to be proactive and go and search for opportunities to advocate, for opportunities to take action and see if we could do something, sometimes very small actions to improve the patient experience. Connected patients with their loved ones, ensuring that effective communication was in place for persons with disabilities, at least to the, the most that we could do. There's always more work to do. When it comes to disabilities, the spectrum is really so broad that we could never cover it all. But at least, with different efforts that we make to raise awareness and to engage the community in our daily, operations and really listen to their feedback. That's what make us, do better and create better practices for our patients. So these are some of the things that we did, and I'm just going to go like one by one and explain to you a little bit more, some of the things that we did. Next slide, please. Interpreting at the front lines. So this, our staff interpreters quickly had to adapt to, interpreting in different circumstances. For the most part, some of us switched to remote interpreting, working from home on different video platforms such as Zoom or FaceTime or different telehealth platforms. But for a lot of other interpreters, where we were still on an intermittent schedule, interpreting at the bedside was still a requirement. And still is. The pandemic is not over, right? We took a little break, I think, during the summer, but now we're back into high alert again. So, of course, there were challenges, when it comes to interpreting. Wearing PPE makes it very difficult for interpreters to project their voices and being able to interpret accurately. There's also a lot of noise, background noise. There are beeping sounds in the room. So that's a challenge, even if you are like working on the phone or joining a Zoom meeting. But of course, staff safety is a priority. It was at all times. And interpreters most of the time have to really push through their fears to perform the work. On the photo here, we have our colleague from South Nassau and her co-worker. They got infected with COVID-19 despite taking all precautions. But they have to quarantine for 2 weeks, and then when it was safe, they returned to work. Some other places like New York I&ER, there were ambulatory sites, and they really continued to perform surgeries all the time. They never really shut down. So they were screening patients ahead of time and performing regular operations. So interpreting there continued as usual. Next slide, please. For some of us, and these are our sign language, part of our sign language interpreting team from Mount Sinai Beth, Israel, agility and creativity meant to quickly switch to remote interpreting, helping families and patients through Zoom, FaceTime, or other telehealth platforms that were available. And for some practices, like for example, myself, I was working from home for 5 consecutive weeks. For us, it meant a lot of back-to-back family meetings with very, very sad and complex cases. And sometimes, you know, engaging family who were living abroad, you know, were really eager to find out about what were the goals and expectations as a family for that patient. We also have a lot of cases at labor and delivery. We had a particular case from a patient who was deaf, and she had to deliver during the peak. And at that time, we use video remote interpreting instead of in person, because of course, safety was the priority, and that was the preferred modality at that time. This was a woman who basically came to deliver by herself, not even a companion was allowed during that week. So it was a very sad and very, you know, can you imagine in a woman's life that it's a critical moment, and she couldn't have any loved one by her side. But we tried to provide the best possible care for her and her baby. Some of the other encounters have to do with patients, you know, who were from oncology, OBGYN, you know, patients who were pregnant and still needed the prenatal care and assistance, cardiology, transplant patients, that never really stopped. So even though we had to focus on COVID patients, we couldn't really forget about our pediatric patients who were there way before COVID, and you know, and their families and their parents who were coming to visit. So, you know, it was really challenging, but this was a time where we all came together because we all had a very clear focus of who we were there to serve, our patients and our families. So at times the coordination seemed like really seamless between, you know, the ICU doctors, the ICU social workers, the child life specialists. There were a lot of families, a lot of COVID patients who were young and they had young children. So we had to really interact, you know, with the children, prepare the children for the news, and the child life specialist and the spiritual care team really played a key role in delivering this news and conveying this message with a lot of empathy, with a lot of compassion. Next slide, please. Yes, so communicating at entry points, of course, was very important. Things were changing, right? We were pretty much not allowing visitors anymore to the hospital. And we all have good intentions, but sometimes things are not conveyed in a proper manner, right? Can you imagine, you know, trying to go and see your loved one and security telling you like, you're not allowed here, you know, we're not gonna let you in. So we really teamed up with the patient experience coaches, and this is when they really help us to create talking points on how to deliver these messages to patients and families with a lot of empathy, with compassion, making them understand that it was really, we need to follow guidelines from the state, and we really need to keep everybody safe. right? So on our photo here, we have also the sign language interpreters at Beth Israel. And in order to ensure that that the security staff knew how to access an interpreter, we installed video remote interpreters or iPads on wheels at entry points. On some stations, you will see a phone. That means that they will access an interpreter over the phone if there is no video. But we train everybody on how to recognize when a family member doesn't speak English or has some sort of disability and look for assistance. Or if the patient is deaf and needs an American Sign Language, they could get an interpreter on video for those types of interactions. Next slide, please. So, making sure that we communicate effectively with patients involved that we needed to create material with a lot of visual content to make sure that, symptoms were clearly understood. And we created this tool in collaboration with many different departments, with infection prevention, patient safety initiatives, our health education department, and medical illustrators collaborated. And of course, our sign language interpreter department provided a lot of feedback as to how the deaf community will interpret these visuals and if they were clear or not. So we involved, patients for feedback on this. And can you imagine at that time, symptoms were changing every week. So we were modifying this every single week. We needed to add a symptom or add a question or make some modifications. And still to this day, this is considered a living document. We're not over, so we're still making changes. But this tool is available if you work in a clinic, let's say an ambulatory setting, and you have patients who are struggling to have access to the building or have access to the clinic or completing the screening questionnaire. Let us know. We distributed this widely, but there's so many entry points that maybe not all of them were covered. But if you know that you may need this tool, for your clinic, please let us know. We will be happy to share. This is also accessible on our, I think it's the COVID webpage that we have. It is accessible there as well. Next slide, please. Thank you. This photo is pre-COVID, and this is part of our vendor team, Language Line, deploying equipment. These are video remote interpreters, iPads on wheels. We deployed equipment all the time, pretty much all year long. But when we knew that, the peak was coming, we deployed additional equipment. We know that video remote interpreting sometimes is not the best interpreting modalities for all patients who are deaf, for example, and communicate by using American Sign Language. It may not be effective communication for them, or if there is any additional disability or maybe a mobility issue in addition of being deaf. This may not be the best tool, but at a time where we needed to keep everybody safe and we needed to comply with social distancing, this was really the preferred modality. I can say that as of today, we're back to in-person interpreter as the first modality, taking all precautions, but we're closely monitoring the COVID situation and the level of exposure that interpreter is going to have in order to determine what is safe. Next slide. Some of the assistive devices that we also deployed are communicards or communication boards. Some of the patients, were nonverbal, and they were they were able to point to how they feel. And in some occasions, we received also requests for sound amplifiers from patients who were elderly, and they had lost either their cochlear implants, their hearing aids, I'm sorry, and they didn't bring it to the hospital. So we provided sound amplifiers in some occasions. Regularly, we ask for the devices back. We will disinfect and replace some of the parts, like the microphone cap. We will replace it completely, and the headsets as well. But during COVID, we basically just gave them away. So I'm also going to be presenting at the end of the page a lot of the assistive devices that we provide, so you can familiarize with them and you know where to request them when they're needed for patients. Next slide, please. Yes, and when it comes to communicating effectively with patients, of course, there is, we heard a lot of feedback from our deaf community and our hard of hearing community about the challenges of communicating with staff who were wearing a mask. As you can imagine, not every patient who is deaf is necessarily proficient in American Sign Language. Some of them rely more on reading lips, right? Lip reading. And also the hard of hearing community, they're definitely not using American Sign Language. They rely more on either written communication and a lot of lip reading. And even though there are different clear masks in the market, there's only one as of right now that is approved by the FDA, and it's the brand Clear Mask, the one that we see on the slide. And I don't mean to, to advertise this brand, but it's the only one actually approved by FDA and our infection prevention team. It was actually approved by our infection prevention team before the FDA approved it in late August. These masks are, of course, expensive, and they're in limited quantities. The intention is to use this mask exclusively for the use of communication with patients who are deaf, hard of hearing, also patients who have had a stroke or have some sort of speech disability, or if the provider finds that wearing a mask, a clear mask, will benefit the patient in general. And of course, the thing here is not about just giving a mask to the patient, it's about everybody else around wearing this mask. And that's why we have to really, have to try to control how many of these masks we provide. And we have limited quantity, but they can be obtained at the Patient Relations Office or the Language Services Department at each hospital. All our 8 hospitals have this mask right now. So if you have a need, feel free to call and request it. I'll provide you some additional information on how to obtain them.
Silvina, is an order required at this point for these masks?
An order?
Yeah.
No.
Okay.
No, not at this time.
Okay. Thank you.
You're welcome. We can go to the next slide, please. And of course, when we talk about the most vulnerable patient population, we couldn't really forget patients who are limited English proficient or patients who have very low health literacy. And we needed to make sure that we translated materials such as frequently asked questions where patients were being transferred from one hospital to the other, right? Sometimes without an explanation. It was just a quick decision that we needed to make in terms of capacity. So we needed to make sure that the family understood why and where patients were being transfer to, what to expect, how to get in contact with the new location, etc. The COVID-19 safety guidelines, the visitation policy that changed so many times, and it keeps changing. We're back to a very strict visitation policy. It loosened up a little bit during the summer, but now with the COVID surge, it's back to a minimum of 4 hours, I believe, and only 2 visitors allowed per day. So we can go to the next slide. This is me working from home. And, you know, at some point when visitors were not allowed, we have to provide a way for families to connect with patients. And at that time, our patient experience data team quickly came in with the idea of creating a virtual visit hashtag, where a team will be on call pretty much 7 days a week, scheduling virtual visits for family members who really couldn't get access to the hospital to see their loved ones. And we also team up with our clinical innovations department, who provided tablets on wheels for these virtual visits to take place. And I can say that it was a lot of work, yes, but it was also a very rewarding experience for us to see how patients and families were connecting. In this particular photo, it was around 7:30 p.m. And I was also, you know, kind of becoming familiarizing myself on how to schedule these visits and how to quickly learn how to use Zoom. And somewhat, you know, I had to witness the entire visit. I realized that in my settings, if I leave the meeting, I will end the meeting for everybody. So I quickly, you know, I hide myself, and I just, I was doing my things while I was literally witnessing the visit. And I could see how the family, you know, this patient was intubated, but still he could hear all the family members. They were laughing, they were making jokes, and he was really making like very minimal movements, but he was responding to them. And after that, I think the patient stayed for an additional 2-3 weeks. And then he went to a rehab facility. He's back home right now, fully recovered. So this was just one of the experiences that we had, but it was really rewarding. It was really helpful to have a purpose, and the purpose was really to help those patients and families. Next slide. For some of the interpreters, working from home really meant to be reaching out to families, checking on families, simply asking, have you received any communication from the unit? Have you gotten a medical update? Do you know how your husband is doing? Have you heard how your mom is doing? And then if, you know, if they say like, no, they called me 2 days ago, but I haven't really heard anything, we're calling the unit, but, you know, as you can imagine, the units were being bombarded with calls. So we were quickly trying to connect, sometimes the social worker from the unit with the family. The social workers, I have to say, they were terrific. They were in constant communication with families, and with us if they needed any assistance in terms of language. So that was really a very rewarding thing. And next slide, please. And when we were looking for opportunities for advocacy, we learned about Angie. Angie is a 34-year-old young lady. She lives in the neighborhood. She's Spanish speaking, and she has Down syndrome. And she was intubated in one of our COVID floors, and her mother was requesting a virtual visit. I have to say that her mother, also Spanish speaking, when I spoke to her, she told me that she had already lost 2 children to COVID in the previous 2 weeks. Can you imagine what it is to hear that and knowing that she had this lovely daughter also at the ICU? We quickly advocated for an in-person visit. We contacted our leadership, who, quickly arranged for the mom to be tested, and then for mom to be, arranged the visit for mom to be escorted in and out of the unit, provided all the PPE. On the initial visit, Angie was heavily sedated, but she could still hear her mother's voice. And we know that because her mother was like, she was smiling. Every time I was asking her, like, would you like to get better? Would you like to see Aunt Maria again? She would smile, right? So we continued to allow these visits, of course. And over time, Angie was safely transferred to another unit. And we can go to the next slide. Just to show you how, she was recovering and she was playing with the nurses. Also our child life specialist really customized iPads for her. She was listening to Michael Jackson's music. She was doing like a spa day with the nurses. She became everyone's favorite patient, and until she was able to be discharged home. At some point, they wanted to transfer her to a rehab facility, and the only rehab facility who was accepting patients at that time was in New Jersey. That was really far for Angie's mom to go and visit. So we advocated again to keep her at our hospital for as long as she needed to stay. And she did. She stayed with us for 45 days, but she really, I feel like she will be in our hearts forever. This was really a lovely patient, a lovely case to collaborate with. And we can go to the next slide. Okay, enough stories for now. I just want to give you a couple of tools for you to see where you could find information about our language assistance program on our webpage. I know our website can look a little crowded sometimes and things cannot be easily found, but if you go to About, you will see language and communication access services. So I invite you to visit our page to find out what we do, the type of services that we provide, and the type of assistive devices that are available to patients at every campus. And next slide. You may or may not know this, but every site has a language assistance program and a patient relations office that assist with the type of work that we are mentioning. So you can always call these numbers during business hours. During off hours, of course, if something happened over the weekend, you should contact nursing administration. They have access to, for example, our list of vendors for ASL. So if there is an emergency, either at the emergency room or one of the inpatient units over the weekend, and you don't know, you are a social worker, you're not sure who to call, you should call nursing administration. They have the information to contact our vendors. Next slide. And this is just a summary of why, working together really, really improves the way we work. And better together is not just, a motto that we chose randomly. It was a thought, and it was put into practice, and it is still put into practice every day. And, I'm really proud of the work that we do. and proud of collaborating with a lot of you on different initiatives, different improvement projects to really better the services that we provide for our patients with disabilities.